Welcome. Hi, my name is Jennifer Haight. I'm with the Children's Bureau. I'm new to the Children's Bureau. I come there from Chapin Hall, where I spent a great deal of my career learning about how to develop and use evidence to support decision-making for those systems that work with children and families. At the Children's Bureau, my primary responsibility is to conduct the Child and Family Services reviews, which is the key way the federal government monitors child welfare programs to see what child welfare administrations are doing, how well they're doing it, whether they have what they need to get their jobs done, and whether all of that effort results in continually improved outcomes for children, families, and their communities.
And hello, my name is Dakota Roundtree Swain. I am a young adult consultant with the Capacity Building Center for States. I first and foremost am a youth who aged out of the foster care system in Massachusetts with little permanency or a support network to support me. But then I started as a CASA supervisor at my local CASA program, working within the courts and really understanding what it's like for families to go through this system other than just my own experience. I now am currently a PhD student in social policy at Brandeis University, and I study specifically foster care reform and policy. Now we have a wonderful video to show you, so I think we can cue that up.
So to me, effectiveness means being able to work in a model and a system that you know is backed by research, by science, by data and design, but is implemented with family in the forefront and with families working together to make sure that children are in safe, stable, and loving homes as quickly as possible.
And so an example of a time that I was able to be effective in my line of work is placing a sibling group of 6 in an adoptive home. Those children were separated in 4 different foster homes prior to that in another state. So just the opportunity to provide them a permanent family where the children could be together and live permanently and have, just a great life.
Well, effectiveness to me means that whatever it is that you're doing, that you receive a result, whether it's positive or negative, and that you act on that result.
It doesn't mean doing things the way we've always done them.
I think being an effective system means creating an environment where people can consistently get those outcomes and get better at getting those outcomes over time.
Really ensuring that you are asking the right questions, that you're bringing the right voices, and that we have a shared definition of what it means to move forward towards change.
And so I think looking back, it has to mostly do with knowing oneself. Why we're here, what's our focus, is our children, our families, and to be able to collaborate with others around us.
The long-term goal in child welfare is to ensure that all children, youth, and families have permanent, safe homes in their community.
From our first contact with children and families, ensuring that each time we do communicate with the family, we're being effective in our communication and in our service delivery, and ultimately that each touch point we have with the family, we're creating an effective, positive outcome.
So effectiveness to me would be creating a system, no matter what your role is, no matter what your role is within that system, that you would be willing to let serve your own family, that you wouldn't have concerns about the quality of services or the outcomes that they would have.
When we look at effectiveness, I think we need to look at the investments that we're making in the youth. And when we're having these interactions with youth as professionals, as caseworkers, we need to really look at each and every one as an individual and look at how we can help them, not just as a case plan, but also as someone who's entering the future.
So don't be afraid to be the innovator. Don't be afraid to be the person who speaks up and says that something isn't happening the way that it should, or it's happening the way that it always has been, and it should be happening differently based on what we know now from the literature, from the data, from the information and best practices that we're aware of.
So tell me what your main takeaways were for today.
Well, so we spent a lot of time today presenting to a very diverse audience of stakeholders in the system from a very diverse audience or from a very diverse group of folks who represent a lot of different parts of the child welfare system, which we believe constitutes a group of people who can work together and independently to make decisions that will improve outcomes for children, families, and communities. one of the things that we heard a lot about over the course of these sessions was that each person as an individual has an opportunity to be effective in the way they execute their job. And a lot of us as well have the obligation to consider how well we're doing our job, or how well the systems in which we work are doing their job or executing their function to create better opportunities and better outcomes for children and families and communities. So one of the main takeaways from me is that, first of all, no matter where you are in the system, whether you're a caseworker making a decision for a single family, or whether you're a Fed trying to understand whether a state's child welfare system is functioning to produce the best possible outcomes, at whatever space you occupy in the system, we all have an obligation to first try and do as good a job as we can and understand that we can always be better, and two, rely on evidence to help us guide where we want to intervene, where we can let the system act as it's acting, and where we need to do something different. Be guided by evidence in how we interact with families, how we help families join us in making decisions that affect their lives, how we use the information that we capture in the case record to understand where we've been effective and where we haven't, and how we summarize all of that information up to understand where systems have strengths and where they have opportunities to do better. So if you go back and reflect on what other folks have said, you'll see that these themes of relying on evidence, making good decisions, understanding where you function in the system and what your obligations and opportunities are, all sort of create great hope for continued improvement in the system, and itself contributes to the evidence base. This is one of my favorite things about the work that I do, is that I work to both generate evidence, learn from it, disseminate it, and keep on doing that. And I think that's sort of one of the main messages we got throughout the day.
Phenomenal. So I really think that it's important for us to understand how casework builds into system review. So we have a graphic that is part of your resource pod. So if you want to follow along, feel free. So it starts with the case notes and reports tier. And this represents the daily, sometimes tedious, on-the-ground data collection that social workers, supervisors, everyone that is basically working directly with the case provides. And it really shows the snapshots of the ground in which we show the evidence-based system review that can be improved through that data. So it's really important, even though it's tedious, to collect that data, definitely. And so we go next into the state administrative data pod. And this is the meso level. So before it was the micro level on the ground work, this is sort of the middle ground between the macro and the micro. So this data involves systemic reviews that use micro data to understand outcomes and potential pitfalls. When it comes down to money, also, the more accurate the data is, the more the state we can have allocated money to the states to have more caseworkers potentially in child welfare services. So this is why the daily data collection is so vital, as you are very much aware. And now as we go up to the national level, to the national statistics, many researchers, including myself, use data and statistics from all of these other levels to have a clear view of what's happening in states to create better policies, allocate money, and build knowledge. But it's not just researchers who use this data. Policymakers, legislators, government agencies, among others, use this data to create real, hopefully lasting change. Your data is vital, and we really need you guys to collect it because it seems tedious on the ground, but it really matters for people like Jennifer and I who are trying to better the child welfare system on a national level. So I think we can move into our conversation around how do we increase the understanding that everyone has a role in improving outcomes and improving effectiveness. So I think you want to start talking about that, Jennifer, and then we can move into my stuff as well. So.
Sure. I mean, I think one of the things that that sometimes people view as troubling, and sometimes if you're me, you view as exciting, is that this increased emphasis on accountability sometimes feels like you're, especially if you're the person on the front line, who is being told that you have to generate data, you have to enter data into the system, you have to record every conversation. It feels like that the accountability is sort of personal. And I think that we live in a culture where we can sort of transform that feeling of sort of being observed for purposes of compliance to an opportunity to be exposed to the information that was not always available at the case level. When you are expected to use evidence to drive your decision making, then you have to have access to it. And so this responsibility to sort of record what you do and when you do it is also, as you pointed out, the way the evidence base gets built. And it's empowering. I think that that's one of, I think in order for it to actually realize its full potential, that's one of the ways that folks in leadership levels within systems have to be accountable to themselves. They have to create the opportunity for people on the line to have access to the information that they're responsible for and to be able to use it in a way to support their decisions. I think that that's the pivotal thing, as you point out on our graphic.
Yeah.
Those decisions that get executed case by case by case and then recorded, they aggregate up. They tell us what's working, they tell us what's not working, and they help us make change.
And I think this is so coming from the Children's Bureau's perspective, I think that's incredibly important to note. Coming from a foster care perspective, when I was in care, I was always, a researcher. So I really looked into the data. And when I felt like this one small person in foster care and no one else was experiencing what I was experiencing, I looked at the AFCARs when I was 16 and found that there were 10,000 other youth in Massachusetts alone that were experiencing exactly what I was experiencing. And it made me feel a lot less alone. So the data that you're collecting on the ground not only matters to practitioners and researchers like me now, but also to the kids that we're serving, because they actually get to know they're not alone and there are lots of other kids like them.
Well, I just have to add that your noting that raises a couple things for me. First of all, that it's not only the data that helps us do better at our work, but it's also sort of, well, I would say it's data, but it's not administrative data. It's creating opportunities for young people like you to participate in their own decisions, right?
Absolutely.
So when you make these data available not only to the supervisors and caseworkers and the partners in the system who are supporting families in making decisions and young people, if you also create knowledge that people like you can have access to, you are creating a space for a voice that we all recognize needs to be heard much more clearly.
Absolutely.
And that too is why I want to sort of flip the script on sort of the obligation to record data as sort of an opportunity to spread knowledge.
Absolutely.
And you can't do that without the very frontline workers feeling the same sort of commitment, responsibility, and power that you get from knowing something.
Yeah, completely. I think this kind of goes into the whole topic that we're focusing on here is effectiveness and child welfare. And I want to just talk a little bit about what that means to me, and I think it means a lot to different people. For me, it's having enough placements so youth do not have to sleep over at area offices because they don't have a place to go. It's helping a mother who has substance abuse problems, really, really working with her holistically so that she can be reunited with her child. It's not aging out of the system without permanency. We can all work on effectiveness and improving outcomes for children, youth, and families. There's the social workers tirelessly fighting for a bed for that child and then advocating in their community to have foster parents step up. There's the supervisor who finds time to collect reports and provide guidance and support to her staff. There's the workers at the Children's Bureau who come to teach us more about what our goals should be, like Jennifer here. We're all dedicated to improving outcomes and improving effectiveness, but these jobs are so incredibly difficult, and it's easy to lose sight of the broader goals. Collecting data is essential on all levels because it really allows us to make those evidence-based decisions, and everyone plays a role in that. So when we collect this data, what we're really doing is finding new ways to help children and families, which I know is all of our goals.
Yeah, well, I really could not agree with that more. I think, though, that what I want to also note, and I know you know this, is that it's not only about the data or the evidence. It's also the decisions that you make, and that I'm advising that people make based on knowledge, on data. They get transacted in relationships. So that's the other sort of admonition I'd want to make, or at least, or maybe it's more like a stipulation that we're not saying data and evidence at the expense of sort of interactions.
That's a really good point.
We're saying that you want to transact your relationships because they're so important. The decisions that you're making should not only be grounded in evidence, and that's sort of what we've been focusing on here, but they should be communicated with kindness, with humanity, with respect. And I guess, to me, the way that you do that is that you create this expectation that making decisions based on evidence is a behavior, just like anything else. Just the way that you work with other people, the way you relate to to the children and families with whom you work, with your supervisor, with the people who work with me. All of those are relationships that the decisions which govern them are sort of grounded in data and evidence, but they're transacted with humanity. Exactly. So we're not replacing the social work with data. We're not looking to have artificially intelligent caseworkers making decisions on behalf of children and families. We're saying that we can do both.
Exactly.
And there's evidence that supports making sure that we do that.
Mm-hmm. I think that qualitative research is a really good sort of way of viewing this too, because I'm a qualitative researcher, and in my research I interview former foster youth about their experiences, and what we found is that the more that they have agency, the more of control they feel like they have. So those relationships that we build really need to involve youth and families and make sure that they feel like equal partners in a process of improvement together, instead of there being an antagonistic relationship. And I think that relationship aspect, I'm so happy you highlighted that, because that's what we do every single day on the ground, is we work with people, and people are not just data, and people are not just statistics. I am not just the statistics of aging out foster youth,
right,
but seeing those statistics helps me feel less alone.
So you mentioned qualitative research. Like, yeah, there's an increasing amount of evidence that says that not only what evidence-based program you might choose is important, but how you do your job, how much time a caseworker has to be with a young person or with a biological family or with foster caregivers, all of that matters too. So we know that it matters. So part of my job is to work with states to understand whether they have the systems in place, like going from the micro up to the macro level, and saying, look, do you support the workforce in the way they need to be supported in order to manifest these behaviors that I think are so important, that you think are so important? So that means not only do they have the skills and ability to understand how to make meaning from administrative data or from case review summary reports, but also do they have the time to be with their families in the way that they need to be with them. That's part of the federal government's oversight. We look at that in the Child and Family Services Review just as much as we look at outcomes at the child and family level. Because if we don't create systems that support the kind of behaviors you and I are talking about, we're not going to be able to see them.
Absolutely.
So there is like this very large virtuous circle that's represented by your graphic, where everything that gets done on the family level aggregates up to system performance. And opportunities to improve exist from the case level all the way up to the system level. And in order to make those improvements, you need to be governed by science, by data, by evidence.
So I'll follow up with that and just ask you, what does effectiveness mean to you in child welfare?
Well, I thought a lot about that, and this is what I'll say. Effectiveness to me in child welfare means that wherever you are in your system, your behaviors are motivated by curiosity, by wanting to know something, by asking questions, by open-mindedness, by understanding that the answer to your question might not actually be what you expected to hear or what you want to hear, but being willing to hear it. And by diligence, which means when you are curious and you ask a question, you answer it correctly. And when you are hearing an answer that you might not expect or you might want to hear, you still are willing to act on it. Be diligent. So to me, an effective child welfare system is one that is populated from the case level all the way up to the federal government by people whose decisions are guided by their curiosity, by their open-mindedness, and by their diligence.
That's a wonderful answer and so well thought out. Thank you for that. So I think we can move towards our closing remarks here at the end of this wonderful Child Welfare Expo. So being in foster care or interacting with the child welfare system is incredibly difficult. You feel like you have no control over your life or your future. And aging out of foster care feels like no one met you who liked you enough to take you home. Our youth and families deserve to work with a system that is effective and that makes it possible to have it be a little less difficult and a little less heartbreaking. We serve our clients, once people like me and my family, to improve their outcomes and circumstances. The best way to do this is with concrete data, evidence-based practice, and continuous quality improvement. I urge you to talk to your clients about what the system actually feels like to them. What does it look like to be a client in the child welfare system? It's a daunting and scary process, but people like you make it a little better just by caring. Thank you for your continued work and dedication to making the lives of youth and family better.
Thanks, Dakota. I don't have a lot to add to that. I want to thank everybody for joining us for this session and for all of the other sessions throughout the day, for being interested, for engaging, for learning, for signaling your willingness to try something new. I do hope that as you reflect on these presentations and the things you might have learned and the new questions that you might have had, that you will, that you might try on what I recommended just now with Dakota, is understanding the quest for effectiveness to first and foremost be a commitment to making decisions that are informed by evidence or data. So you can't be effective without knowing that you're effective, and knowing something requires generating or acquiring evidence. But what I said to you is what I really believe, is that is a behavior. It's not an act. It's not entering a piece of information into a computer or pulling something out, but it is a behavior that is characterized by those three attributes I said before, by being curious, by being open-minded, and I cannot underscore that enough, and by being diligent. And if you do those things, I think that we're all, that we, the children, the families we work with, the communities we work in, and the systems we work to improve will all be better because of it. So that's those are my closing thoughts. I do want to thank everyone for coming, and I'd like to urge you to support us in our efforts to always be better and figuring out how to get better by filling out the evaluation that you will find on the website.
Evidence-based practice.
And finally, we both want to thank you for the work that you do every day to help us help children, families, young people, communities thrive.
Thank you.